Great. My name is Rochelle Crescenzi. I'll be speaking about improvements in pain, quality of life, and tissue sodium in patients with lipedema following decongestive therapy. I have no conflicts of interest to disclose. And so my name is Rochelle Crescenzi. I'm part of an interdisciplinary group of imaging scientists and physicians in lymphatic therapy and vascular medicine. And our group works to develop imaging tools using sodium, adipose, and lymphatic translational imaging to study diseases like lipedema. And we've been using these imaging tools for the past 6 years or so to really try to address some of the clinical unmet needs for lipedema. And specifically, I've really learned these unmet needs from you all, so I thank you for that. And one of the primary needs is for improved diagnostics because lipedema is often misdiagnosed as obesity or lymphedema. And the problem is that symptoms onset at puberty or pregnancy. However, the average age of differential diagnosis isn't until 44 years of age. That's a 20-year gap that we need to overcome. And it leads to the problem that these patients can be mismanaged and after they're misdiagnosed. So lipedema-associated fat is often painful and resistant to treatments for obesity. So not only do we need improved tools to diagnose lipedema earlier, we need improved tools to evaluate appropriate therapies for lipedema. And so some of the imaging biomarkers that we've been working with for the past 6 years, I'm just going to explain them as a background to the preliminary trial that I'll present today. So shown here are some example images from a patient with lipedema. On the left is a whole body image, and this shows sort of the characteristic gynoid fat distribution around the hips in the patient with lipedema here. Next to the whole body image are cross-sectional images in the arms and legs using sodium MRI and conventional MRI. The sodium imaging has been used to show that its tissue sodium is higher in the lower extremities but not upper extremities of patients with lipedema. And specifically, I'll take you through a couple key findings from our prior studies. So our initial studies worked to really address that first need for improved differential diagnostics. And to do that, we studied patients with lipedema compared to female controls, matched for age and BMI without lipedema. And the data shown here is specifically demonstrating that tissue sodium is higher in the legs of patients with lipedema in different compartments in this cohort in the skin and the muscle. And there's an interesting relationship between skin sodium and leg pain experienced by patients. It's a positive correlation that we've observed over the past studies. And so I just wanted to demonstrate that for you here because these imaging biomarkers and clinical metrics of pain are being used to in our next study that I'll present to you, and they really rest on this foundation of doing this in a case-controlled manner. And so the study I'll present today is using these markers to evaluate physical therapy for lipedema. Specifically, the goal of this study was to evaluate the therapeutic potential of physical therapy in women with lipedema, particularly early stage 1 and 2 lipedema. Our hypothesis was that following therapy, pain and quality of life will improve and tissue sodium will reduce in patients in the treated legs. And the study was approved by the Vanderbilt University Medical Center Institutional Review Board and is also registered as a clinical trial. Thus far, we've collected preliminary data from 5 participants that I'll present today. These participants had stage 1 or stage 2 lipedema. 4 out of 5 of them did not have lymphedema. Their mean age was 38.4 years of age. Their mean BMI was 27.2 kilograms per meter squared, and that is not according to their BMI, was not obese. And there we go. So the treatment intervention that was applied to these patients was a physical therapy procedure that incorporated 4 different components: compression, guidance, manual therapy, exercise, and education. So compression was applied as needed and guided according to the patient's needs. For instance, one patient with lymphedema was guided to wear her compression day and night. For manual therapy, these techniques were performed by a certified physical therapist and treated both legs throughout the course of the study. It incorporated techniques such as tissue mobilization, manual lymphatic drainage, myofascial releases, and device-assisted tissue mobilization. The exercise routines that were provided to these patients were also fit to their functional needs. For instance, it could be simple movements like sitting to standing, walking for 30 minutes, moving the ankle, knee flexation, those types of exercises. And finally, education was provided surrounding self-management, nutrition, and skincare as needed. Okay, so those were the components of the physical therapy that was performed. Study procedures are shown here on a timeline. I want to highlight that the entire intervention lasted 6 weeks in a controlled manner for everyone. In the first 3 weeks, patients underwent therapy visits twice per week, and then the second 3 weeks, participants underwent therapy visits once per week with our physical therapist. Study measures were collected at baseline and at the end of those 6 weeks, and those study measures include the MRI imaging as well as clinical assessments. And also daily pain was assessed at each study visit. So it was not assessed daily, but it is the daily pain assessed at each study visit, okay? And the study measurements specifically included pain assessment, asked as the leg pain today according to the visual analog scale from 0 to 10. Quality of life was assessed by survey using the patient-specific functional scale. This scale asks each participant to list 3 different activities that have become difficult for them because of their lipedema. So some examples might include walking for over an hour, being able to, I'm blanking on the other 2. Okay, that's okay. Let me think about that again. But activities that have become difficult. Oh, putting on your socks. Okay, that was one I thought was interesting and very necessary, right? But may become difficult due to lipedema. So the patients would rate those 3 functions and then throughout the study monitor how those functions might be changing because of the therapy. So that's the concept there. And then finally, all participants underwent a sodium MRI exam to quantify tissue sodium in the skin and the subcutaneous adipose tissue regions. So what I'm showing here is an example MRI protocol in the lower extremities that was performed on all participants. You can see that we imaged from the knee down to the ankle using conventional MRI to isolate those regions of interest in the skin and what I'll call the SAT, or the subcutaneous region, and then the corresponding tissue sodium map. So first I'll take you through a case example, and then I'll present the group level results. So this is a case example of a patient who's 28 years old. She's a female with stage 1 lipedema. And after 6 weeks of therapy, her pain reduced from 4 to 0, and her functioning, or her PSFS scale, also improved. And these metrics are clinically significant improvements for this patient. Then by imaging, we observed that tissue sodium reduced 6% in the skin and 19% in the subcutaneous adipose tissue, and that was quantified from the images here that you're observing. So when you look at the sodium MRI map, you might see a lot of yellows and blues, and these correspond to different levels of tissue sodium in that leg. Now, pre-treatment, you observe more reds and yellows in the muscle there. The SAT region is a bit cloudy, and then you can look post-treatment how there is a reduction in the level of those yellow scales of sodium. The SAT region becomes less cloudy, and there's a bit of skin thickness reduction in this patient. So next are the group level results, and on each of these graphs are plotted data pre versus post therapy. Pre-treatment measurements are in red, post-therapy measurements are in turquoise here. The graph on the left is showing data from the PSFS, or Functioning Quality of Life Scale. We observed that all participants improved in their PSFS scale, and this study revealed a large treatment effect size in those 5 participants. The graph in the middle is showing data from pain assessed as the visual analog scale, and all participants reported reduction in pain. And in fact, by visit 8, all participants reported 0 pain in their legs compared to where their baseline was, which we thought was interesting. Pain also had a large treatment effect size in this cohort. There we go. Oh, it skipped my sodium slide. Okay. Next are the results from imaging biomarkers and how they responded to this physical therapy component. And so first, the graph on the left is showing the subcutaneous adipose tissue data, a bit deeper sodium, and then the graph on the right is the skin sodium. And in both cases, we measured a reduction overall in the group effect, and these were pretty large effect sizes, so 8% reduction in the SAT, 9% reduction in the skin. And again, these are only 5 participants, but what the value that came from this observation is that by a molecular imaging marker that is non-invasive and sensitive to something like tissue sodium, we can see a response from physical therapy in just 6 weeks from these participants. So I'll take you through the summary and kind of how we are moving forward with this study next. So in summary, this study today addressed the clinical need for improved tools to evaluate therapies for lipedema. And specifically, I presented a preliminary trial showing that physical therapy reduced pain and tissue sodium and improved quality of life in patients with stage 1 and 2 lipedema. Overall leg pain reduced after each therapy visit, and no pain was reported by visit 8 in our study. Quality of life revealed a clinically significant improvement throughout the study, and imaging biomarkers of tissue sodium may also be sensitive to this response to therapy. So overall, I want to highlight that this is a limited study. It's a proof of concept in 5 participants, okay? But the value is that it motivated a larger clinical trial that's now funded by the NIH and ongoing for the next 5 years. So that was really the value of doing this in a small setting, and now we can really apply that in a larger manner. So thanks for everyone who volunteered for that. Thank you, guys. I just want to highlight briefly my acknowledgments. So all of my collaborators, our lab members, I want to specifically highlight Paula Donahue, who's here with us today. She was our physical therapist on the study and did a fantastic job designing this treatment course for early stage lipedema. And thank you to the Lipedema Foundation for their support over the years, including this study. And thank you all for volunteering and being part of it. And I'll take any questions at this point. So.
Right. The first question is, why study early-stage lipedema?
Sorry, I think part of the motivation here is that there's therapies that are already available. They're conservative. They can be applied in many clinics with trained and skilled therapists. So why not look at the response in patients who are earlier stage to maybe manage that their symptoms in a more conservative manner? I think that was the primary motivation for studying the earlier stage patients. But thanks for that question.
What does increased sodium mean?
That's an excellent question, too. I think in the broader literature, tissue sodium is considered a separate compartment from the blood sodium level. So our blood sodium is tightly controlled, whereas tissue sodium is a storage compartment, for instance, and can be has been related to pain in orthopedic conditions. It's been related to inflammation in some autoimmune diseases, and is becoming an imaging biomarker of, I would say, cardiovascular diseases in a broader setting. In lipedema, though, we don't know for sure whether those mechanisms are at play here, but it is very interesting that tissue sodium relates to inflammation and pain in other diseases. So I would say that's our initial understanding of tissue sodium, but we would love to better understand that contrast mechanism, which requires really taking on some pathology reporting and using biopsies in the same space as imaging. So that's how we hope to improve that understanding better.
And our final question, what type of tissue mobilization techniques and tools were used?
That is a great question. There are... I think in this study, we can talk to Paula about it specifically. I noticed some really lovely stones that were being used, and it really depended on the tolerance of that patient. But I thought that was great. Paula's like, we're good. I think you can talk to her about that more specifically, and I think that would be the best place to answer that question, if that's okay. I would say that, yeah, we did have concepts of superficial versus deep treatment. And I'd like to acknowledge there's a patient with a question here, or a participant with a question. Okay. Sorry. How about I'll chat with you? Oh, which one? Oh, I can't actually advance slides at this point. I'm sorry about that. But happy to share them with you afterwards if you'd like.
I just wanna love you.